So, again, that was my other line, girl. So it's called a comprehensive vaginal microbiome test. Okay. Ask your doctor to ask the lab if they perform this test because it checks for anaerobic as well as aerobic um, bacteria. So it'll be able to tell you whether you have BV, AV, or a combination of the two because you could possibly have a combination. But it is a comprehensive vaginal microbiome test. Okay, and basically it's that's a professional way of saying it checks for everything. It checks for everything, point blank to the period. Okay, so you might want to do that. When we look at um BV versus AV. AV can also, BV can too, but AV, yes, it can be caused by, I mean, it can be, you can have it in your postmenopausal years as well. So people like, I ain't doing nothing, I ain't out in them streets like that, I ain't even got no period, and I still, yes, you can have it. It's because of the lack of the shift and the lack of estrogen. You can actually also have AV. Complications that are associated with AV, you can have infection related miscarriage. That can be a thing sometimes. Premature rupture of membranes, if infection goes from the vagina and it goes up into the cervix, if there is any possible way that the infection can actually, it can eat at the amniotic sac, and the amniotic sac can rupture and infect the amniotic fluid, and that does not lead out for a good situation. It can also stimulate and activate HPV. So even if you have HPV, sometimes it's quiet, it's on chill, it does not do a whole lot. But honey, this the aerobic bacteria can actually stimulate the HPV. It also, just because it can break down the integrity of your vagina and cause all the swelling and the breaking and the ulcers, it increases your risk of contracting STDs as well as PID. And interestingly enough, it can lead to infertility sometimes. So it's very important that if you have these symptoms, they're not figuring out what they are. You have recurrent UTI. And I want to add, if you do have recurrent UTI, and you're checked for this, they're basically, the thought is you want to treat the UTI and treat the vaginal, because if you treat one and not the other, they're going to constantly bounce back and forth off of each other. What does that sound like? Remember I told y'all that about the cervical infection. If you treat one and don't treat the other, the bounce back is real. Okay, so we're going to talk about treatment very briefly because every case is so specific. I really didn't go into detail on the treatment very much, but you will be, I'll give you enough that you'll be able to have a conversation with your gyno if you have a concern that you may be suffering from AV, okay? And our prevention is going to be condoms. Y'all know I can't stand them over at this company, but they got good condoms. B condoms. The letter B is a hologram backs. That's the only one that I'll co-sign because it does, the lubricant on it is not naloxone 9 and it does not cause a vaginitis. So B condoms is that girl. Again, wiping from front to back, please. Front to back. Also, if you are in that menstrual phase in your life, please, for the love of Jesus, change your stuff. Even if you can be like, well, I'm gonna wear a super pad, so I only got to change it one time a day. Don't do that. Figure out your menstrual needs. No, you shouldn't be over bleeding your tampon or whatever. And remember, guys, if you use tampons, please use raw cotton tampons. Please. That's a big deal. None of the chemical stuff, because the same chemicals that are on your tampons are the same chemicals that they use to clean swimming pools. Anything that's in your vagina is a direct shot into your bloodstream. So let's not do that. Let's not agitate that cervix. Let's not cause any more problems than we need to cause. Also, no douching, and do not use feminine hygiene products. Please. You don't believe me? Look it up. Do not use feminine hygiene products, and no douching, please. And have good sexual hygiene. You guys know the deal. You have sex, protected or unprotected. When you're done, please get up, use the restroom so you can evacuate your bladder, anything that may be sitting in your urethra or like the little hole to your bladder, and then get in the shower. So that is definitely what I would recommend as far as prevention is concerned. Now, when it comes to treatment, child, treatment is very different. Interestingly enough, they do not actually recommend oral antibiotics for treating AV unless you're treating a UTI on top of it. So, but if you're not, please, oral antibiotics are not going to be the mainstay, because what they're saying is that you get, if you can actually get the antibiotic directly on to the infected area in the vagina, it gets more, it's more effective, basically. So, if you have recurrent UTI, recurrent vaginitis, please treat the UTI orally. But as far as the vaginitis is concerned, and we think it may be AV, well, we've tested and we know that it's AV, it's going to be a topical. It is going to be a vaginal cream or vaginal gel. And just so you know, if y'all doctors try to throw metronidazole at y'all, metronidazole does not kill AV. It does not. Clindamycin cream does, and a couple of other antibacterials do, but Metro Gel does not kill AV. In my mind, it don't even kill BV, but we ain't gonna have that conversation yet again. We're going to favor the vaginal cream. Also, you're going to do a steroid as well, and that's to kill the inflammation. So it'll be like a steroid suppository, an antibiotic cream, and you'll discuss that with your doctor based on what particular bacteria is affecting you. We'll decide what type of antibiotic that you'll have, but it's basically, and if you're postmenopausal, we want to give you some estrogen. So we'll give you some estrogen if you're postmenopausal, antibiotic cream, and a steroid cream or suppository. And if you are not postmenopausal, then it's just going to be the antibiotic cream and the steroid cream. But again, that's something that you would discuss with your doctor. So I hope this guy, and child, like I said, if y'all got DIV, so DIV stands for desquamative inflammatory vaginitis. It sounds scary as hell, right? Because it is, because she is. So if we've gotten to the point where we got DIV, baby, just call your job, ask for some FMLA. You're going to need a minute to get your stuff right. Like I said, if you're in Atlanta, go on down to Grady and let them folk do what they do, okay? But no, on a more serious note, please don't crowd your doctor's office saying, check me for AV, and because I can't get rid of, yes, if you have something recurrent that it just seems like you're in a merry-go-round, if nobody can find anything and your vagina feels like it's torn to pieces and you just cannot get relief and it's just always something, and you're like, I'm doing what I can and I'm doing all the things, then yes, AV is something you should definitely look at. But guys, even if it's AV, this hygiene thing is a big thing, okay? So again, and I've always told my patients too, if you're a thong wearer, be very, very careful, because sometimes you're getting that poop up in your booty and that get up in your thong and that get into the fibers in your thong, and y'all are washing these thongs with regular detergents. So you ought to be using clean and cute panty wash. But regardless of the situation, be mindful of that as well. Tossing out your panties as you need to. If you got like nice little amount of poop on that thong, girl, throw her away. It's only $5. Throw her away. Don't even risk the risk of infection. It's just not even worth it. So we talked about, like I said, BV and all of the things, and I've had that video a million times over. Go back to my Instagram. Go back to other podcasts. But as far as AV is concerned, this is something that I think that is starting to be more prevalent, and I think that you guys should know about it and have a little bit of understanding. So now you know what your symptoms are going to be, and say to your doctor, hey, can you test me for AV, which is aerobic vaginitis? You know what bugs are going to cause the aerobic vaginitis and what habits are going to cause it and what things will prevent it. And then even in talking with the treatment and say, oh, let me give you this pill. Well, they're saying that the cream or the gel works better with the steroid cream for the vaginitis. And don't be afraid, if you like your doctor and they just don't seem to know about it, don't be afraid to be like, Google this, look it up, let's look it up together, let's talk about this together. And you're helping them with their learning as well, because they may have other patients who have aerobic vaginitis, but if you don't have an understanding of it and if you're not looking for it, you may miss it. And you're like, I don't know what to do with this patient. And that's when they start telling y'all to put boric acid in there, because they be lost, confused. Y'all vagina got them all turned out and they don't know what to do. So I prefer for you guys to have a little bit of knowledge and then maybe take it to them. And this is no disrespect to any other provider. If they don't know, they don't know. If they haven't seen it, they haven't seen it. But maybe working together with their prescription pad and their lab and their testing and your knowledge, that we can get you some relief, sis. So I pray from the bottom of my heart that this helps somebody, and maybe, this is the answer to somebody's prayers. And if they've been in a situation where at this point they're just, disillusioned, hopefully this will bring you some hope, and it'll bring you some relief. So as always, thank you so much for tuning in to Dr. Tasha for the, what we gonna call it, y'all, the Monday medical moment. Hey, but anyway, hope you guys have an amazing week, and see y'all Thursday for Podcast Thursday. Hey girl, this is Dr. Tasha here, and I am here for the Monday medical moment, honey. Yeah, that's what we're gonna name it, the Monday medical moment. So you guys know that, as I see, gynecology is so in depth, right? But as I see things more and more often, I bring them to you. And so you guys kind of determine what I talk about, right? And I've been seeing a lot more of what we call inflammatory vaginitis, right? And it's not that it's rare. It used to be kind of rare, but I felt the need to have a discussion about it because, one, a lot of gynecologists, especially younger gynecologists, they're not really used to seeing it. And it's something that needs to be discussed, because what we're not going to do is keep taking you ladies and running you over the mulberry bush and chasing our tails and not getting you any answers. And then you do what pisses us off by going to TikTok, social media, any other social media to find somebody who don't know what the hell they talking about and trying to sell y'all a product, but y'all are getting more, I guess, interaction with them than you are the provider. So you're more inclined to listen to them, and then you're more inclined to jack yourself the hell up. So tongue pop. With that being said, let me break some stuff down, because I know all y'all know is trichomonas, BV, and yeast, and the combination of them. And now I put y'all on with cervicitis and having cervical infections, but it's some stuff that I have not talked about. In medicine, we say sometimes you have horses and you have zebras. Horses are what you see on a regular basis. That's going to be your high blood pressure, your this, your that, the third. Your zebras are going to be weird stuff like, inflammation of your hyperparathyroid. That's going to raise your pressure. So zebras are things that you rarely see, and horses are things that you frequently see. But now our zebra is starting to turn into a horse, and I think that it requires some discussion, if that makes any sense. So child, let me tell y'all, I don't care if you put the kids up or not, they're your kids, but I'm going to put them up. Going to put these children up, and grab you a glass of wine, grab you a pen. Don't drink too much wine before the pen, because y'all gonna need to take notes on this, because it's a whole situation. I wanted to make sure I brought it to you accurately and I didn't miss anything. So child, my behind even made sure I had my stuff written down, notes, so that my thoughts could be, because y'all know I bounce all over the place, so that my thoughts can be consistent and so that you guys can truly understand this. All right. Now, you have a couple of different types of vaginitis. Now, y'all know I say when we talk about bacteria vaginitis, BV, bacteria vaginosis, or bacteria vaginitis, it's kind of all the same thing, right? And there's 7 types, and I go through that whole thing. If you do not remember it, please go back into my previous podcast. I discuss it in detail. Even when I'm talking about hygiene, I discuss it, because we're really going to be a little bit on hygiene with this particular type of vaginitis we're going to talk about. But we have a few different types. So we have BV, which you guys know about, and then we have AV, which is what we're going to talk about today, and then we have DIV. And DIV is a rare, very rare, very, very rare form of severe AV. So child, if you got this, go on down to Grady and check yourself in their GYN unit and just tell them, just do the thing y'all do down here, because y'all know Grady, all they need is a mustard seed. That's all they need is a mustard seed, and they're going to get you right. Because if you down to DIV, you need some IV stuff, okay? So when we talk about bacteria, you have a couple of different types. You have aerobic and you have anaerobic. Obviously, one requires oxygen, one doesn't. Is that important to you? Absolutely not. Okay, but when we talk about BV, we're really speaking about anaerobic, right? And that is not really inflammatory. To put it in a nutshell, the discharge is not irritating. It might be gray, it might be white. It's going to be more of a fishy or foul smelling odor. But it's you're going to know it's there, but you'll be able to live with it day in and day out if that level of triflinity, or if you're that trifling. But that's a joke. But AV is a little bit different. That's not something you can live with. That's not something you want to live with. And let's talk about it. So AV, which is aerobic vaginitis, okay? And it comes from different organisms. And so this is why it's really, really interesting, because it is far worse. The symptoms are far worse. It is far more irritating. It is painful. It is irritating. We'll get into it, but it's different bacteria that cause it. So if your doctor is just looking for the anaerobic bacteria, like your Gardnerellas, your BDAB2s, your Mobiluncus, if they're only looking for those types of bugs or bacteria that cause bacterial vaginosis, baby, they're gonna miss this altogether. And it gets into a space of, well, you ain't got nothing. You like, no, I know I got something. So your STDs are negative, your vaginitis is negative, but you on fire. Okay, so this is potentially, you may pull back and say, hey, can you check me for aerobic vaginitis? Girl, they might not even know what it is. They might, but that's why I'm teaching you. I can't be everywhere. I can't be up on everybody's, cool parts. So I'm going to tell you what to tell your doctors and say, hey, listen. Now, before I start this, please, everybody, if you don't have this problem, don't go running up in your gynecologist's office talk about something. Can y'all check me for aerobic vaginitis? Y'all gonna tire them people out. They're gonna dismiss y'all from the practice. Don't do that. If you fall into this group that I'm explaining, and you can't seem to get relief and nobody's helping you, can you please then ask, but not just a random, can you just check me for it because I want to be checked for it? Please don't do that. Okay. So the thing about AV, or aerobic vaginitis, is that it's inflammatory and inflammation. So you know what that means. So the symptoms are, let me just read them off to you. I don't want to miss one, girl. The symptoms are inflammation. You may see some redness. There may be some itching. And that sounds like yeast so far, right? But it ain't. That's why I be telling y'all, don't self-diagnose, okay? Some soreness. You may see some ulcerations. So don't be scared. Oh my God, this is herpes. Not necessarily, okay? Painful intercourse. And interestingly enough, your pH could absolutely be normal. Your pH could be normal. You have a change in vaginal odor. And the vaginal odor is a little saucy. It's a little spicy. It's kind of like a rotten meat. I don't know. It smells like poop. It smells like something dead. Like, it's a bad smell. There's burning, there's stinging, and literally, like, your discharge burns your skin. Like, you're like, this is, yeah. So burning, stinging, there may be some swelling. Now, with BV, if you know, the discharge is more thin and gray and whitish, maybe yellowish, but this discharge with AV, the discharge is thick and sticky. It's like a yellow green, and it irritates you. It irritates your skin. But excuse me, there are some people who have no symptoms and still have it. Child, if you ain't got no symptoms, leave this thing alone. Leave it alone. Now, we talked about the different things, those different bacteria that cause BV. Those are your stuffs we talked about. But this can be caused by E. coli, which is in the poop. Enterococcus faecalis in the poop. Group B strep, which is normal bacteria in the genital anal area of women, but in overgrowth in different things, it can cause problems. Staph aureus or staph, MRSA, y'all know, y'all want no trouble with MRSA. Staph epidermidis, and that's just the staph that lives on your skin, okay, as well as Klebsiella. Now, this is not a shameless plug. This is real. This is why when I created the body wash bar, I literally created it with these things in mind. Like, it literally kills these particular bugs, because, you know, just stuff that's on your skin, stuff that's natural in your vagina and your body, it can ultimately cause issues if your level of cleanliness is not where it needs to be. Even E. coli, y'all got to start wiping from the front to the back, okay? From the front to the back. All that dipping down in there and wiping from the back to the front. No, don't do that. No, okay? And let me calm myself down, because I get excited about that. So, you know, a couple of the things when we're dealing with those particular bacteria, you know, poor hygiene after the restroom. Okay, after urinating, clean yourself. Like, after, you know, pooping, you know, make sure, again, front to back. Even when you get them wipes down there, front to back, and keep wiping until you don't see nothing else. And if you got to wipe the toilet paper, flush, and then wipe again, and flush, and wipe again, so what? We don't have a water shortage. Maybe some people do. But even if we do, that ain't the place to take the shortage. Wipe until you see nothing else, and then you use your wet wipes, okay? Water wipes. Y'all know how I feel about them baby wipes. Water wipes, okay? And then unprotected sex is another biggie too. Yeah, so that's a biggie too. All right. Now, when you say, well, how do I know? How do I know whether I have BV or AV? And child, you gonna know if you got DIV. I told you, honey, you gonna have fever, chills, everything else, baby. You be ready to check yourself in somewhere. But the difference between BV and AV is like, how do you know? Well, there is specialized testing, and again, in my office, because I pride myself in, I don't play games with vaginitis. I don't let it play in my face. I don't play games with it. But what I do is I do a test called a comprehensive vaginal microbiome test. Ask your doctor if their lab provides it. They may have to